Okay, and now we've come to the last lesson in this Mother Baby Friendly Initiative, session 5, and it's lesson 5, and I'm still Anna Nolte. So, what we are going to do in this lesson is to talk about all the other steps that we haven't covered yet, and then also talking specifically, it's one of the steps, but we will talk specifically also a little bit about the support of the lactating mother during after discharge. Now, just a quick revision of the 10 steps that we have and the steps that we have done so far. The first step was on the policies, all the hospital policies that needs to be in place to accommodate all the 10 steps. Step 2 was all the knowledge and the fact that the health worker should become competent. That's what you are still busy with. Then step 3 was the antenatal education, all the aspects to educate the mother on, and we have said it's very important in the case of a HIV mother to be educated about all the aspects, but it's also very important for the high risk preterm mother to be educated about the possibility of breastfeeding a baby. Then step 4 was the immediate a postpartum period, the first hour after the baby has been born, the skin to skin contact, and then also the frequent feedings. And then step 5 was all the support that the mother needs during the postnatal period. And here we specifically have talked about the positioning and latching. And then this um, uh, uh, um, 6.1 is on supplementary feeds, and that we will talk a little bit about. And number 7 is rooming in, that we will talk about a little bit. And then number 8 was on feeding, on cue feeding and not demand feeding, and all the cues that we need to teach the mother and how to feed a baby on demand instead of on schedules. And then number 9 was pacifiers and bottles that we have talked about in the previous session. And then number 10 is all the support that the mother needs after she has been discharged, and that we will also talk now a little bit about. So I'm going to do very shortly the steps that's still outstanding. We have talked a lot about supplementing. We have talked about when, in the case of the preterm baby, and we have talked about the donor feeds, etc. But if we just quickly go through what this step says, it says the hospital should support the mothers to breastfeed by giving only breast milk unless there are medical reasons, and then to prioritize the donor human milk, and we have talked about that when a supplement is needed instead of giving a formula feeding, and then lastly helping the mothers who want to formula feed to do it in the correct way. And this also is valid for mothers who want to not breastfeed but to bottle feed their babies. Now, just about this, all the steps and the implementation standards of this supplementation. Now, you can read it on your own. The rationale is to give net, excuse me, to giving newborns any foods or fluids other than breast milk in the first few days of birth interferes with the establishment of milk production. We have said that because, okay, let's read further. Newborn stomachs are very small, that we have said, small capacity of 20 milliliters at birth, and early filled and easily filled with because of the small capacity. And babies who are then being fed with other foods is and fluids will suckle less vigorously because of the fact that they are now not, they are oversatisfied. And if that will eventually leads to insufficient milk supply and production. So that is basically the main reason why we prevent or would recommend that mothers do not give um, breast milk. Now here you can read through all these implementation standards all by yourself. And the very important thing is that mothers should not be discouraged to give any foods, and if they do give any foods, it should be medically prescribed. And then if mothers do give formula feeding because of some other medical reason, or if they don't want to breastfeed, then obviously the mothers need to be educated on how to safely give formula feeding. Remember, the main aim of these 10 steps was to decrease the infant mortality numbers. And one of the big reasons for high mortality numbers is diarrhea and infections. So here our main aim will be to teach mothers to hygienically do formula feeding, and then also to prevent malnutrition by making sure that they give the babies the feed in the right ways. And then our seventh step is rooming in. I think this speaks for itself. Hospitals support mothers to breastfeed by letting mothers and babies stay together day and night, and to make sure that the mothers of sick babies can also stay near their babies. Now, the main aim, and again, you can read through this again, the main aim, if we read through the rationale here, is rooming in is necessary to enable mothers to learn how to recognize and respond to their baby's cues for feeding. Otherwise, they don't know it, or otherwise the baby is becoming on a scheduled feeding if the baby is only coming every 4 hours to the mother or something like that. So that's the main aim, is to keep the baby with the mother so that she can learn her baby's cues and react on that. Now again, like we've said many times, this is only to encourage mothers and not to force mothers. So if a mother is still very tired and she still wants her baby to just go and sleep in the baby room, we should still have the facilities to be able or enable her to do so. But she should be encouraged to keep the baby with her by obviously understanding why it's so important for her to keep the baby 24 hours with her. And then obviously, as we've said also, that in the case of sick babies, it's also important that the mothers should be able to get to their babies as much as possible for the same reason. And then the last one is discharge. Hospitals should support mothers to breastfeed by referring mothers to community resources for breastfeeding support and to work with communities to improve breastfeeding support services. And here again, you can read this all on your own. The rationale here is again that, and we all know that mothers, first-time mothers especially, experience most of their problems with breastfeeding when they are going home and when they are all on their own. So it's very important that we need to make sure that the mothers have a support system when they are going home. Now, it's not always easy because, I mean, all the hospitals, the mothers coming to a certain hospital does not necessarily come from a certain community. Mothers come from all over the place to a certain hospital. But it is very important that the maternity personnel in a hospital should make sure what the community of what support systems there is or are in the community for the mothers, and in the form of baby clinics, in the form of lactation consultants, baby clinics where the mother can, for example, go and weigh the baby and make sure that the baby is gaining weight according to his growth chart so that she knows that the baby is getting enough milk, but also that if she has any problems that she can contact a lactation consultant. And I think hospitals can kind of almost select the lactation consultants that they advise the mothers to use, and they can give the mothers the phone numbers of these lactation consultants so that the mothers know that if she consults this lactation consultant, that she consults a reliable lactation consultant. So mothers should, in the form of a brochure or in the form of some or other written document, I think should get this information about resources in her community so that she knows where she can take the baby to if necessary. It's always better to give it to the mother in writing. I think we all understand that, because there's such a lot of new things to these new mothers that they won't remember it if we don't give it to them in writing. And then also the hospital should be involved, in inverted commas, in community support for breastfeeding, like, for example, advice being given regarding breastfeeding in public places, that public places should be accessible and friendly to mothers giving breastfeeding, etc. So all these are very important, but I think the most important aspect is to make sure that the mother knows who her support system, or what her support system will be when she goes home. And then lastly, just a few words on the International Code of Marketing of Breast Milk Substitutes. I think most of you already know what this code means and what it stands for. I just want to make 100% sure that everybody knows it. It's an international health policy framework to regulate the marketing of breast milk substitutes in order to protect breastfeeding. It covers marketing and promotion of products meant to substitute breastfeeding. It does not ban their sale or their use. It simply restricts how they may be promoted and marketed in order to protect the health of the infants and the young children, to support breastfeeding. So it's basically the focus should be on breastfeeding and not be on the marketing of substitutes. Just to summarize the content of the International Code of Marketing of Breast Milk Substitutes are basically these points. There should be no advertising of products under the scope of the code to the public. So you in your hospital are not supposed to advertise any milk product because of the scope. And no free formula milk sample should be given to the mother of any kind. Even if the mother is very poor, this should still not happen. No promotion of products in healthcare facilities, including the distribution of free or low-cost supplies, should be happening. And no company representative should come to advise the mother. So you can't invite somebody from Nestle, for example, to come to speak to the mothers on formula feeds. And then also, no health worker should accept a gift or a personal sample from any of these formula companies. Now, this is a publication that's available on Google. If you Google it, the International Code of Marketing of Breast Milk Substitutes, and there's another one as well, Working with the International Code of Marketing of Breast Milk Substitutes, a guide. The previous one was by the WHO, and this one is by UNICEF. Both of them are very short publications, so for those of you who don't really know all the contents of the International Code of Marketing, please just Google these publications and just quickly read through what they say. But as I've said in short, the previous slide is basically a summary of what it says. And that brings us then to the end of all these mother-baby friendly sessions, and you need to complete your last quiz in order to continue.